Welcome back, everyone. 16 minutes after the top of the hour. Getting the health care bill passed was just the first step for President Obama. Now comes the hard part, getting the bill actually implemented. Perhaps using a page out of the Bush administration's book could help. Tevi is the former Health and Human Deputy Secretary under President Bush, and he's our guest this morning. Good morning to you.
Hi, Gretchen. How are you?
I'm doing fine, thank you. Thank you so much for getting up so early. So a lot of focus was on actually getting the health care reform bill passed and having the president sign it. But you say, having been in a position similar in the last couple of years under George W. Bush, that implementing it is the key. How do you go about doing that?
Yeah, absolutely. There are a whole bunch of rules that have to be written, complex regulations that will implement the bill, that make the bill actually work, that put it on a real-time basis so that people can understand it. And if you just kind of let this thing sit there and not really put a lot of attention on it, it's not going to happen. As the head of the Kaiser Foundation has said, implementation is not self-executing. It just doesn't happen on its own. So you need to be heavily involved and make sure that you're doing it in a way that people can understand.
That is so interesting because I think a lot of people, including myself, would think, hey, this thing passed all right now. Everything just goes into motion. So who actually will be in charge then?
Well, that's an excellent question. The best analogy I can give is, the Lord may have written the Bible and given it to Moses, but the rabbis actually interpreted the rules for the Jewish people. So you've got these federal career officials who at the Department of Health and Human Services, the Department of Treasury, at the IRS, and they're all carefully watched by the Office of Management and Budget, and they write the rules, and then they go through a very long administrative process to make sure that the rules are comport with federal law.
Uh-oh, you're making my heart go because I'm thinking a bureaucrat, a bunch of them in charge of this whole thing. All right, so let's take a look at some of the things that will go into effect before actually 2014. There'll be a 2.35% Medicare payroll tax, a 3.8% investment income tax, a 2.3% tax on medical devices, and then in 2014, insurance mandate penalties will go into effect. So what I see there that happens imminently is a lot of tax.
Yep. Well, that's the way they wrote the bill for budgetary reasons. They put a lot of taxes up front, and then the so-called goodies, the subsidies as part of the exchange, are going to happen later in 2014. And that was partly for budgetary reasons, but it's also partly because it's going to take a long time to write the rules to make the budget, to make the subsidies and the exchanges work. It takes about 831 days to write a complex rule, according to a Rutgers study, and that might not even be enough time in this case because it's incredibly complex, this one.
All right, you're making a lot of people nervous this morning. Tevi, the former Health and Human Services Deputy Secretary under George W. Bush. Thanks for getting up so early. Appreciate it.